So today's objectives are for you to understand what's meant by physical health. Often when we talk about physical health, when we're talking about people with severe mental illness, we're kind of thinking about illness, but really to focus on health and being healthy. We're going to look at the behaviours that keep us physically healthy, and we're all aware of this. Most of this won't be new to you. It's just about putting it in context, because we all spend our lives trying to think about how we can be healthier. And then we're going to consider why it might be difficult for people with severe mental illness to engage in healthy behaviour, and then that's probably some of the problems that we might face. So when we look at health, what the experts say is that there's 6 determinants of health, but academics have added a 7th one, which is the environmental one. So you've talked about health being holistic, mental and physical. So there's some other elements here. And I think probably as mental health practitioners, you will be fully aware of all the social difficulties that your patients will encounter. You'll be aware of intellectual things, obviously the emotional and mental and the spiritual. So for this session, we are going to focus on the physical side of things. So it's not that I'm discounting those other 6 determinants. It's just that today we're focusing on the physical. And actually, when you talk to people about what's the most important thing around health, people do tend to mention physical health being the important thing. And it's actually probably the thing that's easiest to measure. So it tends to be kind of a thing that's used in general to measure health. Okay, if we have the next slide. So there are some definitions. So one of them being the absence of disease, and that's kind of like from the World Health Organization. And actually people are arguing against that, because you can have a disease or a long-term condition and still be healthy. So that's kind of an outmoded definition of health nowadays, though it hasn't actually been changed. And that was brought into practice in 1948. So people haven't really thought of anything better as yet, or it hasn't been taken on. And then also with fitness can be a definition of physical health as well. Okay, next. So to keep healthy, we have to engage in healthy lifestyle behaviours. So a behaviour is the activity undertaken by someone for the purpose of maintaining or enhancing their health. So it's to prevent problems, or some people do it to achieve a positive body image rather than being healthy. So there will be people who engage in what that might be seen as a healthy behaviour, but actually their goal isn't health, it's to have a nice figure or something like that, and actually that might end up being unhealthy. Okay, so these are things that are included. So we're eating healthily, exercising regularly, making sure that we have enough rest and relaxation. So that includes sleep and in having a sit down and stopping when you're too tired, limiting things like caffeine and alcohol, avoiding drugs and smoking, practicing safe sex, because obviously if you don't do that, then you can catch things, maintaining your physical personal care, and seeking medical care when required. So we're actually going to go through each of these in turn. So if we have the next slide. So if we eat healthily, that actually increases our chance of living longer, and it can prevent some diseases. So there's, things like if you eat bananas, that might prevent dementia. So there's a lot of research still going on that they're unsure of, but we know that some of the fatty foods and that can cause cancers. So if you eat a good diet, that can prevent you developing some of those conditions. It contributes to the development and management of some mental health problems, such as depression. So you'll be aware yourselves, if you've eaten a lot of kind of processed food, not eaten very healthily for a few days, that can actually make you feel physically and mentally kind of sluggish. And so if people are eating like that all the time, it can cause issues. And really, the diet needs the right amount of nutrients. So you don't really need to be aware of all the different kind of foods there are if you're eating a bit of everything, but they do include complex carbohydrates, essential fats, amino acids, vitamins, minerals and fluids. And we need to avoid overindulgences of alcohol and unhealthy foods. Okay, next slide. So when you're thinking about supporting your patients with a severe mental illness, we need to give them the right advice and information. And unfortunately, what I've seen a lot in primary care in particular, that people just tend to tell people what's healthy without finding out what's the person's level of knowledge is. So often, the person has really good understanding of a healthy diet, and we call that diet literacy. So it's not really going to be helpful to them for you to bang on about, you know, what is healthy and give them leaflets and stuff if they already know. So it's about asking them what is it they are eating, and then asking them if they think it is healthy. Because if somebody's eating an unhealthy diet and they think it's okay, then you know that that person does need some help to learn about what is healthy and what isn't. If you ask them what they're eating and they say no, it isn't healthy, then you can then go in and have that conversation about, okay, you know it's not healthy, so why is it that you're still eating it? What motivates you to eat this unhealthy food? And have that conversation there. So it's about getting to their level of understanding. And it may be that it's around what I call diet function, so their opportunity to obtain and prepare food. And I think this is particularly true of the group of people that we look after. Are they able to cook and shop? Some of the people don't have the skills to actually prepare a meal. They've never been shown, or they don't even have the facilities to do it. You know, if they're in shared accommodation, if they're living in a group home and somebody's taken over the kitchen or it's a mess. I mean, you'll know more than me about the kind of situations people have to live in, and that might make it really difficult for them to cook a healthy meal. And also because of their illness, it might be just really difficult for them to make a meal or go shopping because the lack of motivation. So there's something about that we need to look into. What is it that's stopping them from eating healthy diet, and how can we best support them within our roles? And also, of course, if they haven't got much money, then that can make life difficult. There was a study quite a number of years ago in Scotland when they gave people with severe mental illness fruit and vegetables, and they found that they ate them every day. But when they stopped giving them the fruit and vegetables and they had to go and buy them, they didn't eat them. So it's around, there's something around obtaining them. Okay, so have the next slide. So I just thought I'd put some points really about healthy eating and some considerations, because we all need to eat a balanced diet, fruit and vegetables, starchy food, non-dairy sources of protein and dairy with treats now and then. I mean, if you have treats now and then, it stops you kind of craving something, and it gives you something to look forward to. So it's about moderation and everything, really. And then that person might need to make adjustments to a normal diet. So are they vegetarian? Are they vegan? Do they have a particular condition such as diabetes or celiac disease, or any intolerances or kidney disease? And actually, if they've got something like kidney disease, that's really complicated. I would struggle to sort out a diet for somebody with kidney disease because they have to restrict protein and stuff like that. So actually, in those cases, you would want to access a dietitian. And then I just thought I'd put a little bit about diabetes, because actually there's a lot of kind of myths around diabetes, what they can and can't have. So no food is out of bounds. They can have sugar, but in a very small amounts. So basically eating a healthy diet. So the biggest thing for them to avoid is kind of starchy foods. That's really what will put the blood sugars up. So I used to look after people with diabetes, and they used to say, well, I don't have sugar and I'm fine. And it was what was putting their blood sugars up was the fact they were eating tons of pasta and tons of bread and chips and stuff like that. But obviously they need to avoid adding sugar to particularly drinks, because actually that will spike the sugar very quickly. So I'd say with diabetes, it's a normal healthy diet with just avoiding sweet drinks, and that's it really. Okay, next slide. So we're now talking about exercise. How does regular exercise affect a person? So it increases a person's strength, flexibility and endurance, really depending on what kind of exercise that they're doing. The good thing is it decreases the risk of a lot of these conditions, such as coronary heart disease, strokes, diabetes, hypertension, osteoporosis, lots of different cancers. Depression can be prevented and improved, and it's essential to balance your energy and to maintain your weight. You already mentioned about the endorphins. It can provide structure and purpose to the day if you timetable it in around some of your other things. So to stay healthy or to improve health, people need to do two kinds of physical exercise each week. So there's the aerobic exercise, and that improves the efficiency of your cardiovascular system to absorb and transport oxygen. And then your anaerobic exercise, which helps build strong health. So rest and relaxation and good sleep, we need that to function normally. So experts have said we should have between 7 and 9 hours sleep a night, and we're all different. I mean, I function on 6, no problem. But too much sleep can be just as detrimental to physical mental health as not enough. And that's something I know lots of people with severe mental illness may spend a lot of time in bed, vice versa. Okay. So actually, this is what happens when we're asleep. Waste material is removed from the brain. So if we don't get enough sleep, that's why our brain feels claggy and gummed up, really, because it probably is. It restores our bodily functions. It repairs damaged tissue. So if you're not sleeping well, then if you've got anything, cuts and grazes and things like that, or infections, they're not going to get better as quickly as they could. And obviously it conserves our energy. So this is a really important thing. Really important reasons to get the right amount of sleep. Okay, if we put the next point up. So what is it that happens to us if we don't have enough sleep? So if we can put the points up, please. Ooh. So it exaggerates our sensitivity to pain. So that's a really important thing. And we know that happens when people are depressed as well, that they feel pain more. It alters the immune response and the pattern of hormonal secretion, especially the growth hormone. So it's really important. That's why it's really important for children and young people to get enough sleep. And we know that the brain is still developing and people are still growing up to the age of 25 now. So those of you working in the early intervention psychosis teams, it's important that your group of people are getting the right amount of sleep for that reason. If you don't have enough sleep, it enhances your risk of obesity, diabetes and cardiovascular disease. So, you know, very important to be aware of. It can affect our perception, our concentration, our memory, the way we see, how we react, our decision making and our emotions. And we all know that ourselves, don't we? If you haven't had enough sleep, how mistakes can be made. Increases the risk of road traffic accidents and leads to low productivity and mistakes. So we're all aware of what happens if we have too much caffeine, that it can make us agitated and irritable, and it can affect the way we sleep. And I've just put a chart here really to look at the amount of caffeine in each kind of beverage that people might be taking. And we know that a lot of young people, and particularly people with a mental illness, are quite susceptible to drinking like things, caffeinated drinks, and that might even be higher than some of these on here. So that's just something to be aware of. So the experts say around 400 milligrams of caffeine a day is kind of okay, and beyond that is probably too much. So it might be worth working out with your patients how much they're drinking or taking in, and advising them that, and then working with them to try and reduce. Obviously you shouldn't reduce caffeine quickly because of the effects of that, headaches and stuff, if reduced quickly. Okay, next slide. And then I've mentioned alcohol, drugs and smoking, but again, I think within your professions, you're probably very aware of this already, and this is something that you are dealing with. So the recommendations are at the moment to limit alcohol to under 14 units a week to avoid the risks associated with alcohol. And what they're saying is even under that might be harmful. So the risks are chronic health problems, which include mental health problems, liver and neurological, gastrointestinal and cardiovascular conditions, and different types of cancer. It can cause accidents, injuries and poisoning. Okay, next point. And then if we go on to drugs, I'm sure you're seeing this more than me. The short-term effects are appetite change, difficulty in sleeping, increased heart rate and blood pressure. They might overdose. Then there's changes in mood, psychosis. Some of the psychosis that you're seeing may be due to drugs in the first place. They can cause myocardial infarction, which is a heart attack, strokes and even death. So lots of physical issues around drugs. Then you've got the long-term effects of heart disease, lung disease, cancer, HIV and AIDS, hepatitis, mental illness, and then the addiction. And then there's some indirect negative effects of take. So yes, so there's financial effects that it can cause criminality, all sorts of problems with relationships and stuff like that. So there's more than just the drugs. And again, I'm sure you're seeing that within your practice. And then we go on to smoking. Smoking is associated with lots of different cancers, including lungs. It can also cause lung problems and cardiovascular problems, osteoporosis, the thinning of the bones, complications of pregnancy. We talked about this last week. Infertility, oral problems and aging skin. There's plenty more. And it can also affect learning and memory. Okay, the next slide. 37% of people abusing alcohol, or 53% of people abusing drugs also have at least one serious mental illness. And of all people diagnosed as mentally ill, 29% abuse alcohol drugs. It's quite high, it's a third, isn't it? And so the treatment should address both the substance abuse problem and the mental health problem. So the person should be involved in sharing the decision-making process and set the goals, because we know if people aren't keen to change their behaviour, they won't do it. They need to have basic education about their disorder and related problems. So they need to learn about both their illness and the substance abuse. And they need to be taught healthy coping skills and strategies. so we can strengthen their relationships and cope with stresses. So that's easier said than done. Okay, on the next slide. So with smoking, what the research has told us that people with severe mental illness are just as keen to give up smoking as the rest of the population, and they can do it, but they need a lot more support. And what the research has also shown is that supporting them to reduce smoking is often more effective than trying to get them to stop completely. So you should refer them to stop smoking services if they're experience has been that a lot of the stop smoking services don't have any kind of experience with mental health or mental illness, and therefore the people tend to drop out very quickly from those services. So if you do refer somebody to stop smoking, it's really a good idea to kind of see them yourselves, to support them to actually attend the stop smoking services and give them that one-to-one kind of help as well. So they should be offered nicotine replacement therapy just the same as everyone else, though some of the drugs that are on offer can't be given to them. So with bipolar disorder, it can precipitate a manic episode. So that's not a good idea. And then Champix should be used with caution because of the potential increased risk of neuropsychiatric symptoms. So again, these drugs should be used with caution. And then if somebody's reducing their smoking, their antipsychotic medication needs to be reduced, because smoking, the actual smoke will stop the antipsychotic medication being absorbed, so that people who smoke need higher doses. So that needs to be monitored really carefully, and so the person there should be liaison with whoever's prescribed the drug initially, and that in practice is really difficult. Okay, next slide. I think we talked about sex quite a bit last week, but it's really important. So safe sex protects the person and their partners from infections, and this is just some advice for avoidance. So have regular tests, so people can have regular chlamydia tests. That's only one test, but that's kind of the most common one, and people should have chlamydia testing every time they change their partner. So for some people that might be every day. They should use condoms, not just on the man, but also maybe on sex toys. Mutual masturbation, just general keeping clean and washing, and avoiding alcohol and drugs, because obviously if they're taking of those, they might make decisions they wouldn't do normally. Okay, next slide. And maintaining physical personal health care. So this includes all the behaviours that we've just talked about, but also personal hygiene. If people don't wash, shave, cut their nails, brush their teeth, this can cause all sorts of problems. So obviously if they're not brushing their teeth, they can get dental problems, gum disease. If they're not cutting their toenails, they can get sort of problems with their feet. If they're not washing properly, they can develop rashes and kind of soreness. And so the other thing is to actually be applying creams and treatments that they're provided, and it may be that when if you pick up that somebody's sort of got athlete's foot or you know, a fungal infection, that this is something you might get prescribed for them or advise that they buy. So medical self-care is something that we do to manage anything like a minor illness or any injury at home. So we wanted to prevent, detect and treat an illness or condition. So if you've got a big sore on your face, that you don't just ignore it, you go and get the right treatment from the doctor or nurse. Okay, come to the next points, please. Can you think of something that you would do to prevent or to detect or treat an illness? So we seek if there's an emergency, we would do something about it. And actually, this is some people with mental illness may not do this. And I must admit, when I worked in primary care, the biggest thing I saw with patients who'd been discharged from mental health services were the fact that they weren't caring for themselves, and they didn't come in early enough with small conditions, or that they didn't treat rashes or cuts and stuff like that. Okay, next slide. Right, so engaging in healthy behaviour and or changing unhealthy behaviours is really difficult, even when we're well. So for somebody with a mental illness, they do need more support. So that's what we're going to talk about on our next session, is how we can help people with a severe mental illness to try and improve their healthy behaviour.